The NHS is probably the thing that makes me proudest to be British. Proud because it's a national kindness that we all contribute together to make sure everyone is cared for. It's a national selflessness.
David Tennant got a lot of praise on social media for his comments on the NHS, which shows that he is not alone in this. The way he sees the NHS is fairly common. But imagine for a moment how strange it would sound if someone talked about any other institution or any other policy area in such a way. The school system, say, or the pension system. Imagine somebody said that the school system is the thing that makes them proudest to be British. Or imagine somebody described the school system as an expression of national kindness or national selflessness. Imagine somebody said that the school system makes us all better people. That would sound a bit cultish, right? That would sound a bit brainwashed. It would sound like something out of North Korea. Sure, you may have a positive view of the British school system. You may think that you learned useful skills, or you may have positive memories of your time at school. But you would not romanticize it or idolize it. You wouldn't fawn over it. You wouldn't feel a deep sense of gratitude or national pride. But why not? What's the difference? Why do we talk about the NHS in this way, but not about other institutions or other policy areas? Well, it's because we all know that it is quite normal for a developed country to have a school system of some sort, or a pension system of some sort, or whatever it is. We know that that's not a unique achievement. And therefore, we also know that if we did not have the system we currently have, this doesn't mean that we would have nothing instead. If we did not have the current school system, this doesn't mean that there would be no schools. It doesn't mean that there would be no education. It doesn't mean that nobody would ever learn how to read and write. It would just mean that we would have some other system instead. That other system would be organized in a different way. It would be financed in a different way. It might be worse than what we have now, or it might be better. Who knows? But either way, there would obviously be something. And I think that we should talk about the NHS in the same way. If the NHS didn't exist, that doesn't mean that there would be no healthcare. It doesn't mean that we would all die from curable diseases. It doesn't even mean that healthcare would only be available to the rich. It would just mean that healthcare would be organized and financed in some other way. Every developed country has a healthcare system of some sort, and the vast majority of those are universal systems where access to care does not depend on ability to pay. That is not a special achievement. That is a perfectly ordinary arrangement. And compared to other systems, the NHS is not even particularly good. Quite the opposite. Just before the pandemic, we had the second highest rate of avoidable, treatable deaths in Western Europe. I doubt that that has improved in the meantime. In the Commonwealth Fund Studies ranking of healthcare systems, the NHS ranks 9th out of 11 in the category Healthcare Outcomes. And on the Lancet's Healthcare Access and Quality Index, the UK ranks 23rd, so not even in the global top 20. We are, however, in the global top 10 when it comes to healthcare spending as a proportion of GDP. We pay quite a lot of money for a health system that is, by almost any measure, fairly mediocre at best. People can reasonably disagree on what conclusions we should draw from this. Should we adopt an alternative system, or should we try to reform the system we have? If the former, which one? And if the latter, how? Those are debates worth having. What we should stop doing, though, is fawn over the NHS in the way celebrities like David Tennant are fond of doing. It's cringeworthy, it's cultish, and it's totally delusional.